Hello, I'm Dr. Sahil Kohli, consultant neurologist at Narayana Superspeciality Hospital, Gurugram. Today I will be talking about a very important topic, which is brain stroke. The whole topic revolves around what is brain stroke, how to identify if a brain stroke is happening, and what to do if the brain stroke is spotted, and what is the best treatment modality which is available for the treatment. So brain stroke happens when the blood flow to the brain is cut off. It happens because of blockage of an artery, which can be a major artery in the neck, or it can be a major artery in the brain, or it can be a small artery in the brain. So when the oxygen supply to the part of a brain is cut off, the brain cells actually die, and brain cells have a very high affinity for oxygen. If oxygen is deprived of, these cells lose their function, and the corresponding body part develops the symptoms. So there are basically three types of strokes: ischemic stroke, which is because of clotting; hemorrhagic stroke, which is because of the bleeding; and the third one is a transient ischemic attack, which is a stroke where the stroke happens for some time and then recovery happens, and then it can happen again. So ischemic stroke occupies almost 80% of all the strokes, and it is the stroke where the treatment option is available if the patient reaches the hospital in time. So how do we identify stroke? This is a very, very important question. So if you are traveling in a metro, watching a movie, or at a family function, stroke can be easily identified if we learn 4-letter word, which is a very powerful word, which is called as FAST. FAST is actually, F means facial dropping, which is sudden onset; arm weakness, which is again sudden onset; if there is a problem in speech, which is S; and T is time. Time is the most important thing, because if you reach the hospital, a stroke ready center, in 4.5 hours, the total stroke can be treated, and patient can have a good recovery. Similarly, in Hindi also there is a word which is called as bachav, which means बाजू का कमज़ोर होना, च मीन्स चेहरा टेढ़ा होना, आ मीन्स आवाज़ का थरथराना, और व मीन्स वक्त अब न गवाना, 4.5 घंटे से पहले हॉस्पिटल पहुंच जाना. So if we learn these words, it does not require a medical expertise. It can be learned by anybody, and should be known by everybody, that if somebody is having these strokes, we should be able to pick the stroke and then give a proper advice to the patient. So the next question comes: once the stroke is identified, what needs to be done? The common practice which is seen in day-to-day practice is that if somebody is having a stroke, people tend to sleep over. They say, okay, it might improve in the morning, or they sometimes wait at the general physician's clinic, thinking that in the long OPD queues, thinking that they may have a remedy for their stroke, or they will go for a BP checkup, and if BP is high, they tend to take a pill for lowering the BP. I think these all practices should be not done, because brain attack is little different from a heart attack. In heart, there is only one thing which can happen, which is a clotting of a blood vessel. So if a clot happens, you can take a blood thinner, which is called as aspirin, in a heart attack. But in case of a brain attack, we do not know what is the cause, because the symptoms of a bleeding stroke and a clotting stroke, which is because of the blockage, are almost similar. So the first thing is that if somebody identifies that a relative or somebody is having a stroke, we should rush to a hospital where a 24/7 CT scan facility is available. So once the CT is done and the bleeding is ruled out, then definitely aspirin can be given. But however, there are other treatment modalities which are gold standard. So what is the gold standard treatment for acute stroke? If somebody reaches in a hospital within 4.5 hours of stroke onset, we can give a drug which is known as TPA. TPA is a drug which actually works in lyses the clot. It is also called as chemical thrombolysis. So the chemical thrombolysis is actually very effective when it is given only in the 4.5 hours, and if it is given more than 4.5 hours, it tends to have a bad effect. Rather, the chances of hemorrhagic conversion are more, because the TPA drug we are giving is a blood thinner. There is some risk which is associated, that 2 out of 100 people can have what is called as a symptomatic intracranial hemorrhage, which can worsen the prognosis of the patient. But the benefit that is derived after giving TPA is much more, almost 65 to 75%. If you follow them up, after 3 months, they tend to have a MRI score of 0 to 1, which is a near to complete recovery. So So what happens to those 25% people who do not improve even after thrombolysis? This is a special set of patients. These are the patients who usually have a proximal vessel occlusion, whether it is in the neck or it is a major artery of the brain. In these patients, the guidelines say that once you reach a hospital and do chemical thrombolysis, still if we find there is a major vessel occlusion which has not recanalized by thrombolysis by doing a DSA, we can go ahead and do a procedure which is called as a mechanical thrombectomy. So mechanical thrombectomy is a procedure where we go through a blood vessel in the thigh and reach up to the brain and mechanically retrieve the clot. And patient can be as normal as MRS 0. So the message of this talk is that everybody in our household, because we all have patients who are above 60 years, which is the most common risk factor and the age group of patients having stroke. So everybody, us, even our friends, family, even our domestic helps, they should know that if they spot a stroke, very simple, identify them with a 4-letter word which is fast and bachav, and then reach a hospital which has a 24/7 stroke ready center, basically 24/7 CT facility. Once the CT facility is available, patient can be taken up for chemical thrombolysis and mechanical thrombectomy, the results of which are excellent, and many people can almost live their life with minimal deficits or no deficits.